Heart attack is also called myocardial infarction, occurs when blood flow to the part of the heart is blocked, usually by a blood clot. This deprives the heart muscle of oxygen and nutrients, which can cause the muscle to die. Symptoms of heart attack can include chest pain or discomfort, shortness of breath, nausea, and sweating. Other symptoms may include pain or discomfort, the jaw, neck, back, or arms, as well as feeling of impending doom. If you suspect you or someone else is having a heart attack, call emergency service immediately. Aspirin is often used as soon as possible to help to prevent the formation of blood clots and improve blood flow to the heart. Aspirin is often used as a first line treatment of heart attacks because it can help to prevent the blood clot from forming the coronary arteries, which can block the flow of blood to the heart when taken immediately after the onset of symptoms. Aspirin can reduce the size and of clot and decrease the damage to the heart muscle. It works by inhibiting the activity of enzyme called cyclooxygenase, which is involved in the formation of blood clots. Aspirin is also used as to prevent the major of people at high risk of heart attack to prevent blood clots from forming the first place. Thrombolytics, is also known as clot busting drugs, are used to break up the blood clots that are blocking blood flow to the heart. These drugs works by breaking down the clot, which help to restore blood flow to the heart muscles. This can also help to reduce the damage to the heart caused by heart attack. Some examples of thrombolytic drugs are alteplase TPA, retiplase RPA, tenecteplase TNK-TPA, streptokinase. It's important to note that thrombolytics have some risk and side effects, so they are not suitable for everyone. Physicians should evaluate each patient's clinical status and risk factor before deciding to use thrombolytic therapy. Antiplatelet drugs such as clopidogrel and diclofenac are used to prevent blood clots from forming. AC inhibitors such as lisinopril, enalapril, and ramipril are used to lower blood pressure and improve blood flow to the heart. Beta blockers such as metoprolol and propranolol are used to slow the heart rate and reduce the workload on the heart. Nitrates such as nitroglycerin and isosorbate dinitrate are used to widen blood vessels and improve the blood flow to the heart. Statins such as lovastatin, atorvastatin, simvastatin are used to lower cholesterol levels and reduce the risk of heart attack. It's important to note that medications are usually given in conjunction with lifestyle change and close monitoring by healthcare professionals.